All right, now. Okay, now the ethmoid bone. Everybody okay with the sphenoid bone? Okay, now the ethmoid bone, if we look at this, it's on here, it's this yellow bone. Okay, so it's a yellow bone, and it looks different in everybody. Everybody's is different, and they kind of look like, we each have a unique ethmoid bone, and it's got hollow spaces in it, it's got sinuses in it, and that's what makes your voice sound the way it sounds. Okay, so everybody's is a little bit different. Okay, now, what you need to know off the ethmoid bone, you need to know this point part that comes up. Okay, so that little point is kind of like a sail, and that's called the crista galli. Okay, so the crista galli, that's the little point. The dura mater actually attaches there. Okay, now, where's the cribriform plate? Along the sides, right? So the sides right here, so that's where the olfactory bulbs are going to lay, right down in there. Down in there. Okay, and then we have, the nasal concha. Okay, so the nasal concha are really hard to see on here. Okay, so let me show you something once. Okay, you're not going to be able to see them all in this fall, so really you can cross them out. Go ahead and cross them out, and you're going to learn them. I started it over because Eli says that for YouTube viewers, you only make them like not much longer than 5 minutes, or it doesn't download right. Yes, advice from my attendant.
We're crossing out the nasal conchas?
Yeah, because we'll learn them when we do 104. Or do you have to do 104?
No, because I took bio 1
Oh, cool.
So.
Oh, good. Okay. Guys, look up here for a second. Okay, so now, the nasal concha, so here's the mid-sagittal head. Okay, so here's a head that's been cut through. Okay, so inside your nasal cavity, there's 3 bones that kind of go like ridges. And their idea behind them is they're going to increase the surface area so that the air gets moistened as it's coming into your lungs. We talk about them a whole bunch when we do respiratory system next semester. Okay, so this one's the superior one, which you can't see on there. This is the middle, and this is the inferior. The only one I think you can see on the model is the inferior. So it would be really hard to put a sticker on it if you look at it inside there. So I just...
The inside, the yellow piece on the inside here?
Yeah, yeah. So if you look in here, just kind of see that white sticking out compared to the... Yeah. See, it's hard to see. All right, so I won't ask you that. Okay, what's next? This is that sticker on it. Okay, now, Wormian bones. Wormian bones are bones that are actually, they're unique to everyone. Wormian bones are bones that are formed when sutures form. Sometimes a little bit of bone gets stuck in between sutures. So this little guy right here, that's a Wormian bone. Okay, so it's almost like a fingerprint. Everybody has a different one. It's just a bone that's encased in a suture, kind of gets stuck. No, not necessarily. Everybody's are different. So don't worry. It's just kind of like if you guys got on Jeopardy or something, it could win you $1 million. I don't know. It could be on any suture, at any suture, yeah. Yeah. So that's one. There's some here. You just need to know what it is. Like here's one. Yeah, it's kind of like, see, there's a little piece of bone that got trapped between 2 sutures. And that's a Wormian bone.
That's not representing.
No, I think that's supposed to be mastoid process. Okay, now, hyoid bone. Okay, the hyoid bone you can't see on these models. The hyoid bone, and I'll have to move the screen to show it to you. Yeah, go ahead, Lulu. Yeah, it's right here. Yeah. So the hyoid bone is shaped, it's real thin, and it's kind of shaped like a horseshoe, and it sits right under here, right in here. So if somebody gets strangled or hung, it breaks. Okay, so that's on CSI and all those shows all the time, because it's the one, it breaks if you get strangled or hung. It's the only bone in your body that doesn't articulate with another bone. Okay, so it doesn't touch another bone. So it's wired into the skeleton that's in here behind the screen. Yeah. Okay, now, mandible. What's the mandible? Jawbone, right? Lower jaw. Okay, maxilla is the upper jaw. Okay, zygomatic, we already did, right? That's cheekbones. Nasal's right here. Okay, these two little bones at the bridge of your nose. That's nasal. Oh, the cranial markings. Okay, so, let's add lacrimal, okay, because that's one I put on the board. So lacrimal is this one right here. Okay, it's this gray one, or whatever color that is. Tan. Bless you. Bless you. That's lacrimal, so we got lacrimal at each side. Okay, then we have vomer is the bone here. Okay, at the bottom of your nose. That's vomer. Okay, and then palatine bone is, if I turn it over, okay, see this pink? Okay, it's back here. That's the palatine bone. Okay, now let's do the inside stuff. A lot of this is repeated. Okay, you ready? So the inside stuff, so the fossa. Okay, so the fossa are just these kind of like depressions in here, these indentations. Okay, so there's posterior cranial fossa back here. Okay, that's part of the occipital bone. Okay, here's middle, in the middle. Woohoo! Okay, and then anterior cranial fossa is in the front. Okay, so what's going to sit in the anterior cranial fossa? What lobe of your brain? Frontal. Okay, what's going to sit here in the middle one? Temporal, right? Temporal. You guys are saying what I'm saying. Parietal, temporal, the same thing. No. No. Okay, and then back here, what would sit back here? Okay, but what would really sit back here? The cerebellum. Yep, cerebellum actually sits right here. And if you look, there's like little grooves where the cerebellum and then the cerebrum. So here's cerebellum, and then up here's the cerebrum. So this is the occipital lobe. Okay. Now, I think we hit everything else on there because we already did foramen magnum. Where's foramen magnum? Okay, now what's going to go through the foramen magnum? Spinal cord. Okay. How about the optic foramen? What's going to go through that? Optic nerve. Okay. What's going to sit in the cribriform plate? Olfactory bulbs. The olfactory bulbs. And then the dura mater attaches to the, like, this serves as like an attachment point for the dura mater, that crista galli.
What did you say sits in the saddle?
Oh, what sits in the saddle? Pituitary gland. Yeah. So the Celica, no, I always want to say the Toyota Celica. Okay, the Sella turcica. Sella turcica is where the pituitary sits. So just picture a pituitary driving around in a Toyota Celica. All like, no. Sorry. I know, go ahead. Okay, now. Oh, let's do the baby skull, and then we'll list the eye. I do want you to know the bones that make up the eye orbit. Okay, so look here. Look guys look at your eye that you have. Okay, so 7 bones make up the eye orbit. Yep, you gotta know them. Yep. No, I don't know. It's on that list on page 312. They're probably there. Oh, and it's also on page 210. Okay, so look at it and start telling me what bones are in there. Ethmoid. What else did you see? Huh? Sphenoid. Lacrimal. What else? Maxilla. Zygomatic. Not the bone. We're going to your nose. We're looking at the eye. So we want only what's going to be in your eye orbit. Palatine. Okay, so we have 1, 2, 3, 4, 5, 6. What other one?
Frontal.
Yeah, frontal. The big one. I don't have a trick. Do you have a trick? I don't have a trick.
But we have to know this.
Yeah, you need to know this. What are they? Those are the 7 bones that make up your eye orbit. Okay. I think it is somewhere, but I don't know where.
It's on page 310.
310.
299.
Yeah, there they are. Page 299. They're all right there. Figure 7. Okay, I'm going to turn this off. Well, let's do the fontanelles on here and then we'll turn it. Okay, so fontanelles. Well, you're going to need to know where they're located because they're on your list. But if I say, what are the 7 bones of your eye orbit, you should be able to spit it back out. Okay, now, here's the baby skulls. Okay, so if we look at this, okay, so here's the front. Okay, so there's the 2 frontal bones. So this is the anterior fontanelle. Okay, now back here, there's the posterior fontanelle. Right, now, on the side, you're going to see two spots. Okay, so the one in the front is called anterolateral, which would be anterior, so to the front and on the side, right? Which is also named sphenoid. Okay, and then the one back here by the mastoid process is either the mastoid or the posterolateral. Okay. So frontal, or anterior rather, anterior, posterior. Okay, sphenoid, mastoid, or anterolateral and posterolateral.